All right, now workers affiliated to the Young Nurses Indaba trade union are demanding better working conditions and permanent employment for nurses hired during the COVID-19 pandemic. Earlier this week, they marched to the National Department of Health and the Treasury's offices in Pretoria. Members have also expressed how overwhelmed nurses on the ground have been. Young Nurses Indaba Trade Union President Rich Sicina joins us now virtually to tell us more. Rich, I remember this started off when those workers at Bara were let go, right? You tell us, at least, as South Africans, we want to know. We can see the numbers going up in terms of COVID-19 cases. How is it looking at hospitals? Will we need those workers to come back?
Thank you, Masiko. Good afternoon to your team there and also the viewers of the show. Thank you for having Wainitu. Yeah, Masiko, we used to say that department is falling apart. Public health system in particular is falling apart even before COVID-19. I remember we were actually saying it's in ICU, and when COVID-19 came in, it didn't actually bring new problems, but it exposed the roads that is in the system. But now we have realized that we are absorbed by the system. It is actually reducing everyone to nothing, and also wants to render our existence useless in as far as mediocre and substandard performance is concerned. It's like we are normalizing it. The system is not going to cope. We actually going to be absorbed. Because if those numbers are increasing, that department is overwhelmed, whether there is COVID-19 or there's no COVID-19. The rates of admissions related to COVID-19 so far are not alarming, but they are there. We see them coming back, people admitted because of COVID-19, but the numbers are not alarming. But what we are noticing is that this system is actually not coping. It is choking. It became worse when all those who were employed through COVID-19 contracts were shown that door. People, professional nurses on the ground, they found themselves nursing 36 neonates, and we are only 2 on duty. And when we are asking, what happened to other nurses? What happened to other healthcare professionals? Are they absent on duty or are they sick? They will say no. Remember, those who were employed via COVID-19 contract, they actually came and assisted us to ease the burden. That is why then we went to National Department of Health and National Treasury to say, employ permanently. We are not even forcing them to say, go on the street and employ all unemployed nurses. We are actually requesting and asking them and begging to say, please, all those that were employed through COVID-19 contract, let them be absorbed, all of them. All those community service professional nurses, don't release them. Giving them a 2-month contract that is coming to an end next week. What is then going to happen going forward while we are complaining about gross shortage of staff on the ground with them in the system?
So, Rich, basically what you're saying to me, and of course we all agree, I'm sure as South Africans, that the public health system, especially in particular, was already overburdened before COVID-19, and COVID-19 exacerbated it. But what I'm hearing from you is that at least the employment of the staff during the time when things were bad assisted you a little bit, and now the gap is getting larger because they're leaving. So basically what you're saying is that those staff members did assist somehow, and they should be kept.
Definitely, Masiko. They assisted us a lot. I remember it was like a dream. In my facility, where you see 6 nurses on duty. We are used to nursing 45 patients, and we are only 3. And when I'm talking about 3, I'm talking about 1 professional nurse, 1 enrolled nurse, 1 enrolled nursing assistant, because in nursing we have categories. And that simply means if I'm there as a professional nurse, I'm there to nurse 45 kids. You are there to nurse 45 kids as enrolled nurse. We are there to nurse 45 kids. It's like there is no way, Masako, we are going to excel and produce quality in our line of duty. We are forced by default to produce substandard performance. You go to work knowing very well that there is a patient you might not assist. There's a person that might die under your watch because it's humanly impossible for you. We are even saying that difference between private sector and public sector is too big. You go to private sector, you go to ICU, you find a one-on-one situation, one nurse nursing one patient, but not in public sector. You will find a professional nurse in ICU nursing patients who are ventilated, nursing 3 of them. And we are saying this is an injustice of the highest order, because if they crash 2 of them, 1 is going to be sacrificed. Why are they being sacrificed? Is it because they are poor, they are black people? Is it because those in positions of authority, they have money? When they are sick, they don't come to these public healthcare facilities. They go straight to private sector. Why are they neglecting it like this? That is why we are saying now, in this month of May, we are not celebrating any International Nurses Day. We are actually going to make noise and highlight these atrocities, our frustrations, because we are also tired of being used by the system as accomplices of murder.
All right, let me ask you this then. Are you saying that the government is not taking seriously health as a whole? They only take seriously things that happen when COVID, there's a resurgence in COVID, and as soon as that's down, they suddenly let go of those nurses. So it looks to me as if you're saying they don't take public health care seriously at all unless something like COVID happens.
Definitely so. That is why we were actually happy when COVID-19, when COVID-19 came. Even though we were not happy that people will die, we were happy that at least our frustrations, what we always talk about, the gross shortage of staff and gross shortage of material resources, people dying prematurely because they can't be assisted in time in our facilities. We were happy because we knew that there's money that was going to be pumped into the system. We were hoping that at the end of this pandemic, the system, public healthcare system and private sector, by the way, because we saw it as suffering as well, we were hoping at the end of this pandemic, that 500 billion, it won't be something that is now being discussed in inquiries to say who stole and who did what. We actually hoped that maybe at the end of it we will be having facilities, we'll be having enough human resource in our midst. That particular money was going to be used fruitfully, but no. You look what happened in KZN at Prince Msheni. Floods happened. Pipes were washed away. They didn't rush they were not even proactive in as far as bringing water to the facility until the Sicina went to Prince Msheni. That's when the issue of water was fixed. They will wait every time. They are always reacting. They wait for us to make noise, complain, and see videos circulating on social media before they act. It is because we have concluded that those in positions of authority, they are not taking care of public healthcare system because, first of all, they are not beneficiaries of this public healthcare system. Number 2, they
all right, Richard, looks like we've lost your connection.
Our people on the ground.
Well, thank you very much for speaking to us. Wainetu President Rich Sicina. Well, let me tell you something. If you're at home and you have medical aid and access to private health, you better be thankful.